Now time for Dr. Valero to answer questions from our audience.
Okay.
Yeah.
Hi, Doc. Ang question pa is, yung mga cross-eyed ba nakakorek pa yun? Or if nakakorek siya, ano yung process?
Well, yeah, depends on the cause of the yung pagiging bullying or banlag, no? But generally, cross-eyed, yung pagiging banlag or bullying can be fixed with surgery, yung permanent na banlag or permanent na bullying. But there are a lot of times kasi na yung pagiging bullying or pagiging banlag is because of mali ang grado or hindi na bibigay yung tamang grado. And they get what we call lazy eyes, no? So sometimes just putting the correct refraction, especially in children, no, can fix the bullying or the banlag. But pag naging permanent na siya, kailangan na siya operahan.
Doc, follow-up question lang. Pero hindi ibig sabihin yung nagduduling-duling kapag naghipan ka ng hangin.
Gusto yun.
Okay. Meron tayong email question from Rowena Galang. My vision is 20/20, but sometimes I can't read fine print. Why is that so?
Well, sometimes the notation at 20/20 is usually for distance. So if you're more than 40, even if your vision is 20/20 for distance, you might need reading glasses.
Pag
Yung
lumalayo
mahaba
ka
na
na.
yung kamay or lumalayo na yung
Mga
cellphone,
in denial yan.
in denial. So, pag ganon, kailangan na siguro ng reading glasses.
Magpakatotoo tayo. O, Doc, ano na kinahugot mo dyan? Salamin. Okay, next question. Yes? Sino may tatanong? Yes, sir.
Tatanong ko sana kay Doc. Pwede ko ba ma-reverse yung diabetic retinopathy?
Well, diabetic retinopathy for the most part, hindi nare-reverse, no? Ang nangyayari, nasa-stabilize natin siya. So, kaya nga yung sabi natin, importante na makita natin na maaga para habang maaga pa yung stage, very mild pa, ma-stop na natin at that point, no? Kasi pag medyo late na siya, minsan irreversible na rin siya.
Okay. Next question, another email sender, si Romel Santos. I'm diabetic, and how do I take care of my eyes?
So primarily, the most important thing is to control your blood sugar. Make sure that the diabetes is under control. Kahit gaano kagaling yung ophthalmologist mo, kahit gaano kasipag mo patingin sa mata, if your blood sugar is not controlled, also your blood pressure, that can lead to, more severe problems. Another thing is, you need to have regular eye checkup. You need to be screened regularly. Yun nga. Even in diabetic retinopathy, in earlier stages, we don't notice anything. So, we'd like to catch it as early as we can so we can treat it and stabilize the vision at that point na maganda pa siya.
Okay. Last question.
Yun nga po, Doc, speaking nga nung sa early stage ng diabetes, ano nga po ulit yung stage talaga ng diabetes na yung diabetes retinopathy, yung prevent natin yung may stop?
Well, in all stages naman, you can do something to stop it, to stop it from getting worse. Kaya lang, it depends na saan mo siya mahuli. Pag mahuli mo siya na mas maaga, you will have good vision. Pag mahuli mo siya na mas late, kung ano yung vision mo doon, yun na lang yung makukuha.
Talagang importante, prevention.
Regular check-up. Dr. Valero, any parting words for our audience and for our televiewers regarding this condition? Well, I would really advise everyone to see their eye care professional, their eye doctors regularly for an eye checkup so that we can see if we have problems and we can address it early on.
Tapos to, kung halimbawa, na-diagnose na ninyo, di ba? At sinabi kailangan magsalamin. Gusto talaga.
Yes. Kung may sinabi sa inyo yung doktor nyo na may kailangan gawin, may kailangan gamot, surgery, or any other things that we need to do, sundan nyo yung doktor. Tayong naman yung to follow up. Huwag kayong mawawala.
Kailangan ko mag-follow-up. Kasi may nakikita akong mga flash minsan.
You need to be seen.
Baka naman kasi kumikidlat lang sa ulan.
Sabi mo nga, nawakan.
Hindi, ito, Doc, shade. Diba?
Well, yeah, protection from the sun is always a good idea, whether your skin or your eyes. UV protection and even protection from visible wavelengths.
Polarized.
You should, as much as possible, if you wear shades, that would be a good idea.
Okay, pero hindi pwede yung mga sobrang murahin na siya.
Well, the problem there is
Kasi, ano ba talaga? Ano ba yung diferensya yan?
no, well, the only issue there is hindi mo alam kung talagang
May hindi protection.
protection or whatever, no? Kaya hindi, walang track record yung kumpanya na yun kung yung ginagawa nila is tama o hindi. Anything to shield your eyes from the sun is okay. So let's say these people that you mentioned at the start of the show, what are the society of ophthalmologists are doing to curb down the problem? Well, we're trying to advocate nga na see your eye doctor. No? Kasi madaling ayusin kumahanap. If it's late, kahit na gano'ng kagaling yung doktor nyo, kahit gano'ng kalaki ang gastusin nyo, minsan hindi na namin nagagamot. So as INDs or eye doctors, we always advise our patients to have regular screening and regular checkup, which is once a year. At least once a year. If you're not feeling anything, of course, if you're feeling something, huwag mo na antayin next year.
Nahihirap pa. Nahihirap pa, hindi mo na makita.
Sabi nito, next year daw. Next year na.
Bakit computer? Pag-computer sa TV, oo.
Well, yeah. Studies have shown that really, a lot of yung near work, computer work, CSC, yung TV, it doesn't do any permanent damage to your eyes. It will give you eye strain, sakit ng ulo mo, magluluha ka, magdadry yung mata mo. But the next day, you see it all, you'll be okay. It doesn't do any permanent damage. No? But of course, it's a different story if you're in front of the computer 15 hours a day. No? Parang, there are people like that. Well, yeah, it's, you have to take breaks in between. You know? Parang for every 30 minutes, just look away, blink, and put some lubricant drop. But in general, there's really no permanent damage that we can do to the eyes, which, as far as we know at this point, by prolonged computer or TV.
Pero hindi ko sasabihin sa mga anak ko yan.
Pero when they ask me kasi, what do we tell kids na don't stay in the computer for too long? What happens is their social development also is outside there. If you're in front of the computer the whole time, hindi lang mata ang nagkakaproblema, kundi, your interaction with other people.
Basta sasabihin ko, that's bad for your eyes. Anyway, thank you so much, Dr. Valero, for sharing your expertise with us, and thank you also to our audience and our viewers for making us part of your health regimen.
Yeah, and for all those who emailed in their questions, thank you and keep them coming. We'll be answering those in a future episode.
Join us again next week for another enlightening health topic.
Yes, we'll be talking about autism, which is a prevalent behavioral condition now. So if you have questions regarding this, please email them to us. I'm Dr. Oyi Balbuyan.
I'm Maricel Laksa Pangilinan, and remember, don't be afraid to ask because you can talk to doc.